7 signs indicating serious diseases, even cancer. If you have any signs, I'll explain. See a doctor immediately. Your body may be warning you of a serious illness. Did you notice the images I've included? I'll explain each one. There's more than 7 here. I'll connect some and you'll see why this video is crucial. So what are these 7 signs? The first and extremely common sign is this, acanthosis nigricans. What's that, you ask? What could it mean, and why is it so common? Acanthosis nigricans is a dark patch in skin folds. It can appear in armpits or on the neck. This photo shows it on the neck, as it's easily spotted there. You might even notice it on others. It's that recognizable. I often spot this acanthosis nigricans during consultations. Sometimes I wonder, is it dirt? Am I not washing well? Is it just a small stain? But actually, it's not. It's crucial to know this, as it could indicate insulin resistance, which is present in type 2 diabetes. If you notice this spot here in your armpit or neck, you should get your blood sugar levels checked, including glycated hemoglobin and fasting glucose. With insulin resistance and type 2 diabetes, we often see these spots appear. Does it happen in all cases? Do all diabetics have it? No, not all. But if you do, it's a big red flag that your body is signaling an insulin resistance problem. Acanthosis nigricans isn't exclusive to diabetes. If blood sugar levels and glycated hemoglobin are normal, we must still evaluate further. It could be due to a tumor in the digestive system, like the esophagus. Another potentially serious condition that should be assessed. The first sign is crucial, and you need to know this. Everyone should leave knowing that this small mark could indicate insulin resistance. If you have it, see a doctor and request diabetes tests. Agreed? Let's move on to number 2. As an endocrinologist, I must highlight this common sign. It's not just because I deal with it daily, but I'm sure you've seen it. Often people delay seeing a doctor, limiting treatment options as the disease progresses. Now pay close attention to number 2, which is the sign of exophthalmos. What's that? It's when the eyes bulge out or protrude more, in simple terms. I always try to use simple language so you can understand. No point in using complex terms like Graves' exophthalmos. The video's goal is for you to get it. If you've noticed this sign, consult a doctor to check your thyroid. It could indicate autoimmune hyperthyroidism or Graves' disease. It's an autoantibody. Your body makes an antibody that attacks the thyroid, telling it to produce more hormones. This autoantibody trap can also affect the eye area, causing the bulging appearance. I showed this sign as it's easy to spot. The same trap causing Graves' disease can also lead to red, teary eyes. Remember, redness and bulging eyes are key symptoms. You'll see many cases, even on TV. Now you know, you'll start noticing it. I'm sure you know someone with protruding eyes. Always check for thyroid issues, especially if it's new. It wasn't always like that, but now it is. Can you see it in this photo? Oh, it's noticeable, isn't it? There's another body sign of thyroid disease. It's located in the leg area. Can you see it here on the shins? It's called pretibial myxedema. This same autoantibody can also bind to receptors in this area, just above the ankle and below the knee. Can you see the image? It makes it easier to explain. It can also cause changes in the skin. The area may swell and the skin's appearance changes as shown in this photo. This is highly indicative of thyroid disease. It's less common than eye bulging or exophthalmos, but it does occur. A keen-eyed doctor can often diagnose thyroid issues by looking for these signs. Additionally, hyperthyroidism can cause changes in the nails, but I want you to remember the eye symptoms for those interested in leg symptoms. Got it? The third serious sign, and this one too. Notice I'm saying these are all crucial because knowing them can make a real difference. This could mean a much higher chance of recovery, better quality of life, or if you delay or avoid seeking help, serious consequences. I want you to know this sign here, which could indicate skin cancer. Do you see the photo here? Surely you've seen someone with a mole before. This is common. Not all moles or nevi will become or are cancer, but you need to know these characteristics. This cancer type is aggressive and can metastasize. It should be diagnosed early when the chance of cure is much higher. What's metastasis? It's that tricky word. It's when cancer spreads to other parts of the body. Now you understand, right? So it's best to catch it very early, even before it forms, to avoid complications. What characteristics should you look out for? Moles that grow have multiple colors, irregular edges like this photo, or are asymmetrical. See? If split in half, the sides differ. It's asymmetrical, unlike normal moles. Also, watch for moles that itch or bleed. These are signs of melanoma skin cancer. You must pay close attention. This point here too. When I worked at basic health clinics, many were surprised when I referred them to remove a mole or mentioned it could be cancer. Isn't that just for skin doctors? The answer is no. General practitioners can assess and refer to specialists too. After all, not everyone with a mole can see a dermatologist, right? There are very different realities. So general doctors can evaluate moles and refer to specialists for removal if needed, okay? Don't wait for a specialist appointment. Talk to your doctor if you have concerns. It could be skin cancer, and early detection can save your life, okay? Everyone understood this, right? The fourth sign from my field of endocrinology that you need to know about is these violet stretch marks. Can you see the photo here? It's not just any stretch mark, but a specific one larger than a centimeter. Are you looking at this photo? These are large, wide stretch marks. They're big, purple, and violet in color. What might these stretch marks indicate? They could point to a condition called Cushing's syndrome. It's a disorder in cortisol production. It may mean excess cortisol. You have too much of it. This can also affect blood pressure, blood sugar, and body shape. It's called centripetal obesity. Big belly, moon face, buffalo hump. But focus on these stretch marks. If you notice purple or violet stretch marks on yourself or someone else, it's important to check cortisol levels. These types of marks strongly suggest a cortisol issue. When cortisol is high, it becomes very difficult to manage blood pressure, blood sugar, and cholesterol. Excess cortisol can lead to serious health problems. This isn't the same as the temporary cortisol spike from everyday stress. I'm talking about a more serious ongoing issue. This could be caused by an adrenal tumor producing cortisol or a tumor in the pituitary gland that stimulates cortisol production. So it's crucial to evaluate these changes and check cortisol levels. Because if it were just stress, wouldn't almost everyone be sick? But it's a change that suggests uncontrolled production of the hormone cortisol. The topic of cortisol often has many myths circulating on the internet. Non-specialist doctors sometimes share info without proper knowledge or experience. So it's not just stress. It could be a cortisol-producing tumor. Some meds can cause these changes, but they're used under medical supervision. I want you to remember it might be due to excess cortisol production. Got it? Sign number 5 may indicate high cholesterol. As I've said before on this channel, cortisol is good. We need cortisol to survive, make hormones, and vitamin D. It's also needed for digestion and cell membranes. It's good. But excess cortisol, especially LDL, can cause heart disease. This sign, xanthelasma, suggests high cholesterol levels. It's also extremely common. You've likely seen someone with this. Check cholesterol levels. Often, patients with this have very high cholesterol needing treatment. You might think, but this is an extreme sign. However, some people with high cholesterol have this sign, xanthelasma, but it appears milder. Take a look at this photo. Often people don't notice it, or it's even smaller than this, so be aware it could indicate a blood fat problem. It's important to check the levels too. Sign number 6 is this change in the tongue. The tongue becomes redder and smoother as it loses its papillae. Can you see it in the photo? It doesn't have all those taste buds. This could signal a vitamin B12 problem. Vitamin B12 deficiency can cause this change. Why did I mention this deficiency? Because many groups have 20 to 30% vitamin B12 deficiency rates, or even higher. For instance, people who've had stomach surgery, those on plant-based diets, or folks taking meds like metformin or acid reducers such as omeprazole, esomeprazole, or pantoprazole, even elderly people who gradually lose their ability to produce stomach acid. This capacity diminishes over time. It's not like your body suddenly stops producing at a certain age. No, that's not the case. It doesn't happen to everyone, but it becomes more common. So you need to pay closer attention and regularly check your blood vitamin B12 levels. Don't wait for symptoms to show up. What else can happen with a deficiency of this vitamin? Blood changes leading to anemia and all its related symptoms. Fatigue, paleness, shortness of breath, plus our central nervous system needs B12 too. So it can cause numbness, memory issues, and if untreated, even lead to dementia. It's crucial to pay attention to these points I've mentioned in the video. Did you know this? It's a reversible cause of dementia. With proper treatment, we can prevent and improve this condition. If you have vitamin B12 deficiency, which we've seen is quite common, not everyone with this vitamin deficiency will show this sign. It's very important to note, okay? That's why regular testing for this vitamin is crucial. Sign number 7 is crucial. The ear mark, this diagonal line shown in the photo, can indicate heart disease. It may signal increased risk of heart attack or cardiovascular issues, but does everyone with this sign have a heart attack? No, not everyone. It's a key trigger to check heart health, cholesterol, blood pressure, and sugar levels. If you have this sign, get your heart health evaluated. I've made videos on pre-heart attack signs and important cardiac risk factors. Click here to learn more about it. It's crucial that you watch it. Take care. See you next time.